want to take this opportunity to thank ITPC for supporting my organization and myself to conduct interviews with the young people living positively in South Sudan. This opportunity has given us the chance to touch base with these people on the ground, and it has also given us an opportunity to see who are the organizations that are working with these people and what do they give and what strategies do they use to intervene in places where young people living positively may need their activities and their work to be done. This opportunity has also given me the chance to interact with the young people living positively, especially the interviewees, on specifically what were the challenges they faced during COVID-19. And above that also, we were able to gather information on key challenges that young positive face in South Sudan. During the interviews, we noted that there is no confidentiality where access to ARVs are given in the main hospital, that is Juba Teaching Referral Hospital, and as such, young people fear that they may meet people who know them. They might meet even their parents who do not know their status in such an open place. So this has made young people to shy away from getting services at the hospital, and it has actually made the situation worse because they do not have where they can get their services in a very private and confidential place in South Sudan. We have also noted that during our interviews, interviewees also said the issue of food during COVID-19 was very scarce, especially for young people who work on selling tea, because most of their workplaces were closed and they did not have where to have food. But where they give supplies in the hospital, they only give to people who are malnourished, people who are bedridden. Meanwhile, for them who looked very stronger, were isolated or were not given these food items, which are given to people living with HIV in the main hospital and different community hospitals. So this has actually made young people to lose hope, and some have gone with one meal a day, which is very sad. And out of what we have seen also, young people already losing confidence, and they're already saying this is a suicide, because taking medication when you're on an empty stomach, it's very dangerous, and they're already losing hope. So this is really very sad to know about this. And we also noted that during the interviewees, because most of the reproductive health services not in a confined area, and they are all placed where mothers also go for their antenatal, and which is very it makes them actually shy away from accessing contraceptives, and they are asked questions. You're not married, you do not have a family, why do you have to go and access this? So they are discriminated from getting these services, and from the health providers themselves, they are called names, and as they give ARVs, as they give these contraceptives, they are called names, because basically in South Sudan, we still don't have the age of consent. At what age has a young girl or a young boy have to access these services freely without discrimination? And also during the interviews, the interviewees noted that information on sexual and reproductive health was not accessible, because during the COVID-19, there were restrictions on movements, there are restrictions even going to workplaces. So mostly people access information through virtual meetings, virtual recordings and all that stuff. And because they also have a challenge to technology and issues of smartphones, so they are deprived from getting vital information on COVID-19 and even vital information on HIV prevention, care and support system. Yet they are supposed to be informed about what is happening surrounding COVID-19, issues of sexual reproductive health, and issues of HIV prevention in the country. Yet, one of the interviewees also noted that due to the economic crisis, there are hikes on transportation from long distances, so that has hindered her from accessing her medication on time, because most of them live far away from the main hospital where they get their medication from. So this has also been a challenge of COVID-19 and also the issue of the economic crisis within the country. One thing that we also noted from the interviewees, as one of the interviewees also noted, that young people take contraceptives to only prevent pregnancies, but they don't fear getting HIV, but they fear getting pregnant. So that is also one thing that we noted, that most, because in South Sudan, most women-led organizations focus on the campaigns to stop early pregnancies and early child marriages. So I think that campaign must be able to mainstream issues of HIV prevention, because young girls already have that mentality of, if I get pregnant, I will not finish my education. Yes, that is also good for a young girl to have access to contraceptive, but also contraceptive must be given with information that guide them on how to prevent HIV, because if you can prevent yourself from getting pregnant, meaning these young people do not have access to condoms to prevent HIV infection. So these are some of the discussions that we held with the interviewees. Otherwise, I felt it was an opportunity for the organization to get in touch with these vulnerable young girls who do not have access to information. And I am very glad today to inform you that Young Positive is already having a database of these people, and see how we can work together and how we can try to channel information to different people at the grassroots level who do not have vital information on COVID-19 and even information on HIV prevention, care and support system within the community. Meanwhile, it is also sad to note that within the communities where my interviewees are living, there is no community support system. And one of them said, if only you're known that you're HIV positive, that is like a death sentence in the community. You will not even move on the streets in peace. You will not eat your food in peace in your own compound. You find people like trying to gossip, call you names. This is already half dead. This is somebody people should not associate with. And once a male greets these young people in their own communities, they already call names. You're a killer. You know, that gives me that makes me very sad, because the communities where we live in are not informed about how to take care of persons living with HIV/AIDS, because these are people who might have contracted the disease from mother to child, and these are people who might have contracted from their partners, and some of these people might have contracted the disease from blood transfusions and in hospitals and all these places. So basically our communities already have that perception that HIV is only got through sex, which has made it very difficult for them to relate well with the young people living positively. As such, young people living positively are called prostitutes, are called names that makes them actually feel demoralized, makes them stigmatized within the communities. So I think this was really a timing opportunity for us as Young Positive, and personally I have gone to different community health systems within South Sudan, and I have observed and seen that issues of confidentiality are not put in place. We are already in discussions with the different people within the country to see how we can make sure that these centers where ARVs are accessed are made confidential in a way that everybody who goes there is treated as any other human being, because they have right to access their medication. Yeah, I think that is really very important to me, and I thank you so much, Emma, for giving us the financial support to have these interviews. Thank you.